With so much information out there about cancer, what are some of the common myths that people can often believe?
Little bit of myth busting. Okay, you do not need your breast off to treat a breast cancer. Complete misnomer. In fact, the survival is better if you do a breast-saving operation with radiation than a mastectomy. I've already myth bust and said you don't start by cutting to diagnose what it is. You do a needle biopsy. Let's look at common things that people ask me. Underwired bras don't cause cancer. Keeping your money in your bra does not cause cancer. Okay, roll-on deodorants does not cause cancer. Cell phones, no. How do cancers start? Cells undergo division in our body all the time, and it takes about 92 divisions to go from a normal cell to a cancer cell. And we have little repair genes inside the cell that are trying to fix the cell, and little hyena cells surrounding it that are trying to kill it. And if that combination doesn't work, little hyena cells are stressed, then these abnormal cells escape and you develop this little cancer plant. Okay, 65% of people who get breast cancer have no risk factors. 25% of people have family history on their father and their mother's side. That is why it's important to know your family history, not just of breast, but of other cancers too. Prostate in men, skin, stomach, colon. You want to know your family history. Okay, you can choose your friends and not your family. Know your family. Okay. About 8 to 12% of people have single gene abnormalities. You hear people talk about BRCA1 and BRCA2. Now we all have BRCA. This is where you're missing repair genes so that you're at higher risk of getting a cancer. However, it's not 100% of people who have these genetic abnormalities who get cancer. It's only 65%. Why? Okay. You can't prevent cancers, but you can decrease your risk. How do you decrease your risk? Exercise and a BMI under 30. So those are important. Obviously, we encourage people to eat healthily. I always say something of every color. That doesn't mean every Smartie. It means your greens and your reds and your yellows, etc. But it's not one thing. It's not sugar causes cancer, or it's a combination of factors. Okay. As soon as people are diagnosed, we've done studies where they grab their supplement jar and their vitamins, and we've Googled this, and we're going to take this, and we're going to take that. Herbs are medicines in themselves. Okay, so remember, since the beginning of time, our medicines are based on, some of our chemotherapies are developed from mushrooms. In fact, one of our most successful chemotherapies with breast cancer is from ash tree bark. Aspirin, as you know, it is from a natural substance originally. Look at how we understand everything from the morphines to the drugs, the heroines, is from the poppy, right? There's a lot of interest, etc., in medicinal marijuana, okay, which works partly as a medicine for supportive care and then partly as a drug with significant side effects, right? So I think what we need to be aware of is whether it's too much water or too much of something, everything can have a helpful and a harmful property. So if you are dabbling or taking an interest in or considering, you must let your treating oncology team know, because we have lots of medical sites where we can check and make sure that things don't interact. If you don't take one thing that interacts with something else and then it's not effective. Like there was a lot of work done, St. John's wort, in the data around HIV medication and deactivating. So you've got to understand that herbs are medicines in themselves. Okay. So other myths that I think, someone biting your breast or trauma on your breast, people often say, I bumped my breast and then I noticed the lump. Well, I think because they bumped their breast, they felt their breast and then the lump was there. So trauma doesn't cause cancer. Okay, it's not one thing, it's a combination of factors.